Urine is not just waste that leaves the body, it is also a vital indicator of overall health and a sign of kidney function. Today, we will explore the reasons why urine can foam and provide clear solutions when this happens, especially if it's a sign of kidney problems. Why does urine foam? Urine can foam for various reasons, sometimes temporarily, without any major health concerns, or due to significant underlying issues. Regardless of the cause, foamy urine generally means the kidneys are working harder than usual, which can be a signal of stress or strain on the kidneys. While occasional foam may not be alarming, it's important to keep in mind that this could still indicate that the kidneys are under stress, and you should manage and monitor your kidney health to avoid further complications. Why foamy urine is related to kidney health. Understanding the structure and function of the kidneys can explain why foamy urine occurs. The kidneys' glomeruli, tiny filters in the kidneys, are tightly woven to prevent large particles like proteins from passing through. When the kidneys become damaged, these filters loosen, allowing large protein particles to be excreted in the urine. When proteins, such as albumin, are released into the urine, they resemble soap-like substances, creating foam when they come in contact with water in the toilet. This condition is known as proteinuria. Proteinuria can range from mild to severe, and it's essential to identify the cause and take appropriate action. Let's explore the causes of mild proteinuria and how to address them. Causes of mild proteinuria. Proteinuria doesn't always mean that the kidney's filtering system is permanently damaged. Temporary kidney stress can cause foam in the urine. In these cases, the protein levels in the urine are very low, and a medical test may not even diagnose it as proteinuria. However, it's still crucial to ensure that the kidneys don't become further stressed. Here are 4 major causes of temporary foamy urine. Intense exercise. When engaging in intense physical exercise, the blood flow to the kidneys may temporarily decrease, reducing the kidney's ability to filter properly. This can cause foam in the urine. The good news is that once the exercise is over and the body rests, the foam usually disappears. There is no need to worry if the foam is temporary and resolves after rest. However, if the foamy urine persists for several days, it could indicate that muscle proteins like myoglobin are being released and are clogging the kidney filters. In this case, it's essential to address the issue promptly to prevent further damage to the kidneys. Dehydration. When the body is dehydrated, urine becomes concentrated, and substances that create foam, including proteins, are excreted, making foamy urine more likely. This is especially common with the first urine in the morning, as the kidneys have been concentrating the urine overnight. Prolonged standing for long periods can cause blood to pool in the kidneys. As a result, the glomeruli in the kidneys may become overwhelmed and filter more blood than they can handle, allowing proteins to be excreted in the urine. If you notice foam in your urine suddenly, it's worth checking whether you've been standing for an extended period. If you have a job that requires standing for long hours, it's helpful to elevate your legs before bed to reduce the strain on your kidneys by reversing the flow of blood. Excessive meat consumption. Consuming large amounts of protein-rich food, such as meat, can also lead to foamy urine. If you eat more meat than usual, you may notice foam in your urine the following day. This places additional strain on the kidneys, so while occasional increases in meat intake may not be a cause for concern, frequent occurrences could lead to kidney damage. To protect your kidneys, it's important to limit excessive meat consumption. Health tip: how to differentiate between normal urine and proteinuria. Foam in urine can occur due to friction with the toilet water, but the foam from proteinuria is different. The foam from proteinuria remains in the toilet and doesn't disappear easily, even after flushing. It can stay present for up to 10 minutes, unlike normal foam that dissipates quickly. So, if the foam appears briefly and then disappears, there's no need to worry. However, if the foam persists, it could be a sign of proteinuria, and it is recommended to consult with a healthcare professional. If foam in the urine lasts for more than 10 minutes, it could indicate proteinuria, which is a sign of kidney damage and requires prompt medical attention. It's important to distinguish between temporary and persistent foam in the urine because while temporary foam can sometimes be harmless, persistent foam often suggests underlying kidney issues that need addressing. Causes of dangerous proteinuria. Dangerous proteinuria is often linked to damage in the kidney tubules and can be classified into two main categories: glomerular proteinuria and tubular proteinuria. Both conditions indicate serious kidney problems, but they affect the kidneys in different ways. Glomerular proteinuria. This condition occurs when the filtration barrier in the kidneys, specifically the glomeruli, becomes damaged or loose. Normally, glomeruli prevent larger proteins from passing through into the urine. However, when the glomeruli are compromised, they allow an abnormally high amount of protein to leak into the urine. This is a sign that the kidneys are not functioning properly, and the condition can be a precursor to kidney disease. Tubular proteinuria. Tubular proteinuria results from damage to the renal tubules, which are responsible for reabsorbing filtered substances like proteins back into the bloodstream. When the tubules are impaired, proteins that should be reabsorbed into the body are excreted in the urine. This condition typically results in the appearance of smaller proteins, such as beta-2 microglobulin, lysozyme, and amino acids, in the urine. If a urine test shows small amounts of protein alongside substances like microglobulin, lysozyme, or amino acids, it indicates tubular damage, and kidney function needs to be monitored closely. In cases of glomerular proteinuria, where a significant amount of protein is excreted, it indicates more severe kidney damage, and corrective measures to improve kidney health should be pursued immediately. Health tip: understanding glomerulonephritis and pyelonephritis. Many people mistakenly confuse glomerulonephritis and pyelonephritis because both conditions affect the kidneys, but they are distinct and require different approaches to treatment. Glomerulonephritis is an inflammation of the glomeruli in the kidneys, often caused by an autoimmune response or infections. This condition leads to various chronic symptoms such as swelling, fatigue, itching, and high blood pressure. It is usually a more gradual condition, where kidney function deteriorates over time. Pyelonephritis, on the other hand, is a urinary tract infection, UTI, caused by bacteria that infect the kidneys. It is an acute condition that presents with symptoms such as fever, nausea, flank pain, and vomiting. Pyelonephritis typically results from untreated or recurrent UTIs and requires immediate treatment with antibiotics. Understanding the difference between these two conditions is critical for appropriate diagnosis and treatment. While glomerulonephritis may require long-term management of kidney function, pyelonephritis can often be treated effectively with antibiotics if caught early. How to improve kidney health? Both glomerular and tubular proteinuria are often caused by poor blood and energy circulation around the kidneys, which leads to inefficiencies in kidney function. Improving the flow of energy and blood to the kidneys can help prevent further damage and promote healing. One of the most effective methods to boost kidney health is through abdominal pressure massage, specifically targeting the areas near the kidneys. These areas are usually marked on the body, and applying gentle but firm pressure to these spots can help stimulate blood circulation and break up any blockages in the energy flow. Performing this abdominal pressure massage 1 to 2 times a day for 20 to 30 minutes each time can help to restore proper circulation to the kidneys and bladder, encouraging better kidney function. This practice not only supports kidney health but also helps improve overall well-being by promoting better circulation throughout the body. If you found this information helpful, please feel free to give it a like and leave any questions or comments below. Remember, maintaining kidney health is vital for your overall health, so take steps now to protect and support your kidneys. Stay healthy.